across the globe to stories here at home. This is the National News Broadcast. A very good evening to you. I'm Sharifah Tahir.
A very good evening to you. I am Dishant Veerakone, and we start off by taking a look at your headlines for tonight. Secretary General of the United Nations assures maximum UN support for Sri Lanka's development. Sri Lanka receives another batch of Pfizer vaccines. Australian health divisions reiterate that low vaccination contributes to the re-expansion of the coronavirus. The Rajarata farmers complain that a certain group is striving to create a conflict between the farmers and the government. A 14-year-old child is killed in a clash between two groups in Veerakatia. The Canadian general election begins. A person with Sri Lankan origins is among the competitors. The United Russia Party of President Putin wins the Russian parliamentary election. Now moving on into those and other stories in detail. Today is the Binara full moon Poya day. According to the Sasana history, it was on a Poya day such as today that the Lord Buddha had granted permission to establish the Meheni Sasana, or the female Bhikkhu order, to 500 women, including Queen Maha Prajapati Gautami, who had received ordination and Upasampada Vinaya Karma. Arhat Ananda Thera was reported to have received the approval of the Lord Buddha to establish the Bhikkhuni Sasana. As a result, the Ashtagarudharma, or the 8 noble disciplinary precepts, were enacted on female novice Bhikkhunis. Many Pinkamas or meritorious deeds are being conducted on the Binara full moon Poya day as well in all Viharasthanas during the current vast season. The 214th sermon in the series of Amadam Sisilasa Dharma Deshana was conducted at the temple trees today. The Dharma sermon series is being conducted on a concept of Prime Minister Mahinda Rajapaksa. Accordingly, a Dharma Deshana is taking place at the temple trees on every Poya day. Madam Shiranti Wickramasinghe Rajapaksa has offered the traditional Dahat Vatya, inviting the Venerable Thera to deliver the sermon. Today's sermon was conducted by Arunayaka of the Sri Lanka Ramanya Mahanikaya and head of the Pathanduvana Bhikkhu Training Centre in Minuwangoda, Venerable Nadagamwe Vijita Maitri Thera. Prime Minister Mahinda Rajapaksa has offered the Ashtaparishkara Puja to the Venerable Thera at the end of the Dhamma sermon.
අපි කාගේත් බලවත් ප්‍රසාදය පුණ්‍යානුමෝදනාව එතුමා වෙනුවෙන් පැවැත්විය යුතුව තිබෙනවා.
The Saddharma Varsha Binara Poya live transmission of the Sri Lanka Rupavahini Corporation was telecast throughout the day from the Sri Suramya Rama Purana Viharasthana in Madinagoda today. The Dhammasarathi Dhamma discussion was conducted under the direction of visiting lecturer of the Pali and Buddhist Postgraduate Institute of the Kelaniya University, Darshanapati Venerable Maharagama Ananda Thera. The Saddharma Varsha was comprised of many programs including Atasil, Buddha Puja, Dhamma talks and community hospitality services.
President Rajapaksa briefed the UN Secretary General on the challenges facing a country like Sri Lanka with a small economy in the face of the COVID pandemic. President Rajapaksa spoke at length on the impact of the COVID-19 epidemic on education and the economy of Sri Lanka and thanked the World Health Organization for its support to overcome the pandemic. The President pointed out that more than half of the total population has been fully vaccinated and that all arrangements have been made to fully vaccinate all those over the age of 15. And we will be moving on to that story in detail. The United Nations Secretary General Antonio Guterres says that the United Nations will provide its full support to Sri Lanka in moving forward to promote unity among different communities. The UN Secretary General made these remarks during the meeting he held with President Gotabaya Rajapaksa at the United Nations headquarters in New York yesterday. UN Secretary General Guterres warmly welcomed President Rajapaksa when he arrived at the United Nations headquarters and reminisced about his visits to Sri Lanka in 1978 representing the Inter-Parliamentary Union and his visits to Kandy, Anuradhapura, Polonnaruwa and Trincomalee. UN Secretary General Guterres also recalled his dealings with Sri Lanka during his tenure as the United Nations High Commissioner for Refugees and his meeting with the then President Mahinda Rajapaksa in 2006. The Secretary General noted that Sri Lanka is a country which plays more active role in social and economic spheres in the Indian Ocean region The UN is expected that Sri Lanka would continue to do so in the future too, despite the crisis that has plagued it for nearly 30 years. President Rajapaksa said that he was pleased to have the opportunity to hold a bilateral discussion with the Secretary General of the United Nations and congratulated him on leading the United Nations during a difficult period facing the world, as well as his re-election as a Secretary General. President Rajapaksa briefed the UN Secretary General on the challenges facing a country like Sri Lanka with a small economy in the face of the COVID pandemic. President Rajapaksa spoke at length of the impact of the COVID-19 epidemic on education and the economy of Sri Lanka and thanked the World Health Organization for its support to overcome the epidemic. The President pointed out that more than half of the total population has been fully vaccinated and that all arrangements have been made to fully vaccinate all those over the age of 15 before the end of November by showing the statistics. The Secretary General commended the progress made by Sri Lanka in the vaccination drive. The President pointed out that the COVID-19 pandemic was a major obstacle to fulfilling the pledges made to the people when he became the President in 2019. Even amidst this situation, the President elaborated on the steps taken to address the issues that arose in the aftermath of defeating terrorism that lasted for 30 years. The President explained the compensation paid to the victims, the transfer of lands back to the owners, and the massive development carried out in the North and East provinces since 2009 under the guidance of President Mahinda Rajapaksa and the opportunity given to democratically elect the representatives to the Northern Provincial Council. The President informed the Secretary General that the government would take immediate action with regard to missing persons and expedite the efforts such as issuance of death certificates. The President pointed out that many youths who were arrested as suspects over terrorist activities were released after he came to power. The President informed the Secretary General that legal action would be expedited with regards to the rest of the personnel who could not be released and that he would not hesitate to grant a presidential pardon to the Tamil youth who have been in custody for a long time, taking into account their long-term detention and after the legal process was completed. The President stated that his objective is to strengthen the democracy in Sri Lanka and accordingly there are no baton attacks or use of water cannons on protesters under his government and that a separate area has been set aside for protesters near his office. President Rajapaksa also explained the engagement with civil society organizations to bring about development and reconciliation in the country. The President said that the internal issues of Sri Lanka should be resolved through an internal mechanism of the country and said the Tamil diaspora would be invited for discussions in this regard. President Rajapaksa said that he was always ready to work closely with the United Nations and added that he would assure that there is no room for separatism to re-emerge in the country. Sri Lanka as a government and other states should be vigilant about religious extremism. In the meantime, the Epidemiology Unit says that the number of persons who have received both doses of vaccines under the COVID immunization program has increased to 11,093,465. Meanwhile, another stock of Pfizer vaccine has been brought to the island at dawn today. A batch of 73,710 US manufactured Pfizer vaccine was brought to the Bandaranaike International Airport from Qatar by the QR-668 aircraft. Thereafter, the stock was transferred to the Colombo Central Vaccine Depot. 24,866,036 vaccine doses have been given to the people under the COVID vaccination program. 13,772,541 have been given the first dose of a vaccine. 11,093,465 have been given the second dose of the vaccine. 766,673 doses have been inoculated in the past 7 days. 62,008 vaccine doses have been given yesterday. The program to inoculate persons between the ages of 20 and 29 years has been conducted continuously in many districts. Inoculation of persons between the ages of 20 and 29 years has commenced in 17 centres in the Trincomalee district yesterday. It had also been reported that any person above the age of 20 years is able to receive the vaccine from the centre at the Medical Officer of Health Office in Kantale. Mobile vaccination programs are being conducted island-wide for persons above the age of 60 years and also for those with special needs. A house-to-house vaccination program has taken place today as well in remote villages in the Manmune Divisional Secretariat Division in Batticlaw today. In-house vaccination campaigning has also been conducted for persons above the age of 60 years and also for those with special needs in Ratmalana, Moratua and Dehiwala areas today. The program has been carried out through the initiatives of the Sri Lanka Army. 836 COVID-19 patients were detected in the country today. 60,016 persons are currently receiving treatment. Meanwhile, 1,055 patients left the hospitals today following recovery. The total number of fully recovered patients is 433,093. The Director General of Health Services has reported 93 COVID-19 related deaths which occurred yesterday. 68 of them were those above the age of 60 years. The number of victims between the ages of 30 and 59 years is 24. One of the victims is under the age of 30 years. The program to treat COVID-19 patients with complications in their residences is being carried out continuously. The resident patients are able to receive medical advice by dialing the telephone number 247. They can also send an SMS over the telephone number 1904 regarding enlightening physicians on the disease conditions of the patients. These patients also have the facility to obtain the services of the suicide ambulances through the telephone number 1990. The Health Division say that special attention should be focused on the complications that could arise in the post-COVID season. Handing over bags of consumer items to families undergoing quarantine in the Nivithigala electorate has taken place at the Nivithigala Viharasthaniya yesterday. The event has been organized by the Ramya Jana Sahana Foundation and businessmen in the area. A group including State Minister Janaka Wakumura was also present at the occasion. The Divisional Secretariat Division Office of the Vanatha Villua has donated a consignment of beds, mattresses and mosquito nets to the COVID treatment centres of the Department of Ayurveda. The National Youth Services Council is conducting musical programs for the mental relief of persons staying at home due to the imposition of the quarantine curfew. One such program was held at the State Apartment Housing Complex in Jalthara, Panagoda yesterday. The series of programs is dubbed as Be Happy with Youth. The Sri Lanka National Tour Guide Lecturers Association has organized a blood donation campaign at the National Blood Transfusion Centre in Narahampita today. Measures have been taken to conduct the program with the disclosure on the depletion of blood stocks at the centre. The Pindenia police station has arrested 6 suspects who have arrived at a residence where a COVID-19 patient undergoing quarantine to purchase cannabis. The suspects were produced before the Kagol Magistrate Courts today. The courts has ordered to quarantine the suspects in the same residence for a period of 14 days.
Meanwhile, family health specialist Dr. Malkanthi Galhena made remarks on the ongoing home-based care treatment process for COVID-19 patients in the country.
When we provide treatment for the patients who have been selected for the home-based care, we know that some of them also getting the complications even though it's rare. So we have identified patients who get complications are the patients who didn't get or completed the 2 vaccine course. So because of that, I urged always for all family members as well as to the public to get this vaccine without any delay at the earliest possibility, because it prevents your life going into the complications of COVID infection, or it really prevents deaths as well. Compared to the previous, once we started this program in 16th of June this year, now we are experiencing very much less patients coming into the system. It may be due to the lockdown, the effect of the lockdown, as well as the vaccination program successfully going on throughout the country. So we are happy because the patients' burden and the suffering of patients are getting less with these 2 effects. There are so many prescriptions with medications are coming in social medias. So sometimes they prescribe by doctors or indigenous medicine, whatever, whoever. The COVID infection is a deadly disease. But if we look after them properly under the proper guidance of care, the patients can be recovered. More than 80% of patients can be recovered without any complication. So because of that, I would like to mention that depending on the patient only, we can recommend the medication, the doctor who is looking after that particular patient, because this COVID infection shows the variation of symptoms coming in. This is the symptomatic treatment we really need to provide, not a curable one. So because of that, it depends on the patient's symptoms. It can vary from one patient to another patient. So the common prescriptions with drugs and medicines will not be going to help follow. Sometimes it may be harmful to the patient as well. So I urge not to go for these common prescriptions which circulate among the various social media, thinking about the patient safety. There are so many misbeliefs for this vaccine. So because of that, some people are reluctant to get this vaccine, thinking about those misbeliefs. Researchers have been proved that these vaccines are there to increase your immunity as well as it prevent you going into the complications of the COVID infection. So please be mindful to get these vaccines at the earliest possibility without thinking about these misbeliefs. For parents, I would like to give this message because government is thinking to provide vaccines for your children before they start the school. So whenever the government is recommend these vaccines for your children without any delay, please go and give the vaccines to your child without any delay, because it will prevent your child is going to get serious issues regarding this COVID infection.
In the meantime, Minister Prasanna Ranatunga says that a special relief package will be implemented for airline companies which conduct flights from the Mattala Rajapaksa International Airport. The aim is to attract international aviation companies to the airport. The relief package is for international airline companies which have not yet conducted operations from the Mattala Airport. It has been proposed not to levy the $60 airport immigration tax for companies for a period of 2 years from the date of commencement of operations. Consultations are also expected to be provided on landing of aircraft and on parking charges. Discounts are to be provided on charges for a period of 4 years since the commencement of airport operations. It has also been planned to fully exempt all charges relating to landing and stationing of aircraft in the first year. In the second year, a 75% relief is to be extended. The relief package for the third year is 50% of the charges. The government has also decided to free 25 charges in the fourth year. A 14-year-old student has been killed in a shooting incident in Gajanayaka in Veerakattiya. The incident took place around 11 p.m. last night. The shooting has occurred during a brawl between two groups of relatives. The seriously injured child was admitted to the Veerakattiya District Hospital and later on to the Tangol Base Hospital, where he succumbed to his injuries. The Veerakattiya Police Station is conducting further inquiries. The police media spokesman, Senior Superintendent of Police Nihal Thalduwa, said that the suspect responsible for the murder was reported to have fled the area with the firearm. He adds that several groups of officials have been deployed to arrest him. The acting magistrate, Balas Mulla, has inspected the scene of the crime this morning. The SSP further says that a group of CID officials were also engaged in inspections of the location this morning. The police media spokesman further said that the Veerakattiya police station is conducting further investigations.
Now, the banana village of Nachaduva in Anuradhapura was inaugurated yesterday. The village has been established under the Saubhagya Production Villages program. Now, the objective of the Production Village program is to strengthen the rural economy by encouraging home-based products. Accordingly, 100 families in the Nachaduva banana village are to receive aid amounting to 10 million rupees. Cultivation wells for the supply of water is also being constructed under the program. In addition, other items including banana plants and water pumps are being provided free of charge. Non-Samudi recipient families have been selected for the project. The aim is to set up 500 Saubhagya production villages during this year. The expected revenue addition to the national economy throughout this project is 1.5 billion rupees.
Farmers of the Rajarata say that the efforts of certain groups to create a conflict between the farmers and the government by highlighting charges on reduction of paddy prices and decline in harvest due to application of organic fertilizer must be defeated. They have expressed their opposition to the accusations after media briefing in Ittavava in Mahapaladikulama in Anuradhapura today. The protesting farmers have also pointed out that they have received less than 20 rupees for a kilo of paddy during the previous regime. They have also recalled that they did not receive any fertilizer subsidy during the period of the previous government.
In more stories, the Department of Agriculture has focused attention on the introduction of a supplementary crop by the name of Ipanella Mungwagawa. The department adds that the introduction of the new crop paves the way for the provision of a certain quantity of nitrogen required for the absorption of the organic fertilizer. The green gram cultivation is taking place in the paddy fields of the Alahara farm settlement. These cultivation lands are being nurtured through the application of organic fertilizer. The green gram harvest is expected in 45 days. The farmers say that the intercrop farming enables a bounty harvest and additional income as well. This is the story of a farmer in Gangeyaya in Amblipitya who has received a higher output through the application of solid and liquid organic fertilizer. The farmer, W.K. Wilfred, manufactures around 10,000 kilos of organic manure in a month. He says that he earns additional revenue by selling the surplus produce. Development Officer at the Agrarian Services Centre in Mhintale, Mrs. Shyama Hewagamage, is another owner of a large-scale organic fertilizer manufacturing plant. She adds around 80,000 kilos of organic manure to the total fertilizer production in the area. Shyama Hewagamage hopes to increase production by a further 10,000 kilos at the end of this month. El Abdul Ghafoor of Atala, Chennai in the Ampara district has reaped a bountiful apple harvest by using only organic fertilizer. He says that his aim is to engage in cultivations of numerous crops using only organic fertilizer.
Installation of new water connections under the concept of water for all by the year 2025 has got underway in the Katana electorate today. Minister Vasudeva Nanayakkara and State Minister Dr. Sudarshini Fernandapule have also participated in the event. 1,500 persons in 300 families are being benefited by the project. The Karagal North Circular Road is being developed at a cost of 40 million rupees. The objective of the government is to upgrade the conditions of 100,000 kilometers of roadways. State Minister Tharuk Balasuri has presided over the inauguration of the road reconstruction recently. 4 Anicuts in the Suryapura farmer settlement in the Mahavali D zone is being reconstructed under the Vari Saubhagya program. The total anticipated cost exceeds 20 million rupees. The work is scheduled to be completed within 3 months. 700 families will be benefited. State Minister Siripala Gamlath was also present on the occasion.
Well, that's a wrap of tonight's primetime news bulletin here at Rupavahini ChannelEye. And until we meet again next time, do take care, stay safe, and good night.
Have a pleasant night.